Hello everyone. Today we will discuss on the topic vital signs. So firstly we know about what is the vital signs. Vital signs are the key physiological measurement that provide crucial information about the person, body function and condition. These measurement help healthcare professional assess overall health, monitor patient condition and identify any potential medical issues and monitor the effectiveness of the treatment plans. The most commonly measured vital signs are include body temperature, pulse, respiration rate, blood pressure, and in some cases, oxygen saturation. They reflect the body physiological status and provide information about the person with current condition and state of health. The frequency of vital sign assessment depend upon the person conditions. The more critical the patient condition is, the more often these signs are needed to be taken and evaluated. And to access the vital signs on the patient admission before and after any invasive diagnostic or surgical procedures, monitoring during recovery, before and after medication that affect cardiovascular or respiratory functions, in any emergency medical condition. So let's see one by one. First, body temperature. Body temperature reflects the balance between the heat production and heat loss in the body. It is an important indicator of the metabolic activities and can indicate a variety of indications of conditions such as infection, inflammation, or disorders of thermoregulations. The average normal body temperature for a healthy adult is 98.6 Fahrenheit. It means 37 degrees Celsius, though it can be vary slightly between individuals during the day. The factor influencing the temperatures are time of day. The temperature tend to be lower in the morning and higher in the afternoon or evening. Physical activity or exercise can rise body temperature. Health status. Fever is a condition, common sign of infection, inflammation or illness, while low temperature can indicate exposure to cold environment or certain medical conditions. Common temperature measurement sites includes mouth, under the arm and in the ear, with the latter typically providing the most accurate reading. Then second is the pulse rate, means heart rate. Pulse rate is the number of heartbeat per minute and it is a key indicator of the heart function and overall cardiovascular health. The normal range of the pulse rate is generally between 60 to 100 beats per minute. The factors influencing the pulse rates are the age. Children and infants typically have a faster pulse rate than adults. Then fitness level. Well conditioned individuals often have lower resting heart rates due to improved cardiovascular efficiency. Then physical activity such as exercise, stress or excitement can temporarily increase the heart pulse rate. Health conditions such as fever, anemia, heart condition and anxiety can raise heart pulse rate, while certain medication like beta blocker can lower it. And next see the respiration rate. Respiration rate refers to the number of breath of a person takes per minute. It reflects the body ability to take in oxygen and expel out carbon dioxide. It is an important measure of the respiratory function and can indicate conditions like respiratory distress and or metabolic abnormalities. The normal range for the healthy adult, the respiratory range between 12 to 20 beat per minute at rest. Infant and young children typically have higher respiration rate. The factor influencing respiration rates are the age. Newborn and children generally have the faster breathing rate than the adults. Activity levels such as physical activity, such as exercise, increase the demand of oxygen and thus rise the respiration rate. In health condition like pneumonia, asthma, chronic obstructive pulmonary disease can alter the rate. The higher altitude may cause an increase rate due to lower oxygen level in the environment. And next is the blood pressure. So blood pressure measures the force of blood against the wall of the arteries as the heart pumps it throughout the body. The normal range of the blood pressure is 120 per 80 mmHg. The blood pressure is expressed as two types such as systolic blood pressure and diastolic blood pressure. Systolic blood pressure is less than 120 mmHg and diastolic blood pressure is less than 80 mmHg. The factor influencing blood pressure such as age, physical activity, diet and weights, health condition, medications. Blood pressure is typically measured by the sphygmomanometers. Then next we see the what is oxygen saturation. Oxygen saturation measures the percentage of oxygenated hemoglobin in the blood. It indicates how well oxygen is delivered to the tissue and organs. The normal oxygen level from 95% to the 100% in healthy individuals, though value as low as 90% may be acceptable in the some medical conditions. The factor influencing the oxygen saturations are respiratory disease condition like chronic obstructive pulmonary disease, asthma, pneumonia or COVID-19 can reduce oxygen saturation level. Altitude, people living at high altitude or those traveling to the higher elevation may experience slightly lower oxygen saturation due to reduced atmospheric oxygen. Then heart or lungs conditions, poor blood conditions, poor blood circulation or lungs conditions. Disease can lead to be hypoxemia, which means low blood oxygen levels. Oxygen saturation is commonly measured with a pulse oximeter, a small non-invasive device typically attached to a finger or toe. So that's all about the vital signs. Thank you.